I'm your host, Adrienne Gold Davis, and that I'm really excited that you joined us because on today's Boost, we're going to talk about something that's so incredibly important, and that's breast cancer awareness and detection. So a few weeks ago, I posted this kind of crowdsourcing for women in Momentum who've experienced breast cancer. I guess I wanted to know what was the most useful and what was also the most annoying to them as they began their journeys. And that post, it exploded. There were hundreds of Momentum sisters sharing their experiences, their preferences, their annoyances. And there were responses that ran the gamut from things like, just treat me like I'm a normal person and don't ask for food, just bring food. And over this past 6 months, there have been Momentum sisters as well who've experiencing this alone without community support. And so we are really grateful today to welcome Andrea Wolfe and Melissa K. Rosen. They're our guests, and we're hoping that this will begin a new source of support, of strength, and of hope to Momentum women and, of course, women the world over. So you should know that Andrea Wolfe is the CEO of the BREM Foundation to Defeat Breast Cancer. She works to maximize every woman's chance of catching an early, curable breast cancer by expanding programs, education, and access to testing for medically underserved people in the DC area. And Melissa K. Rosen, well, she is the Director of Training and Education at Sharsheret. It's a nonprofit organization with the goal of supporting Jewish women who've been diagnosed with breast cancer and ovarian cancer. And she oversees community education and training for healthcare professionals and Sharsheret's volunteers, as well as the Sharsheret Supports Partnership Program. And as I welcome you, ladies, and sorry I made you wait, I want to begin with asking you two things. First of all, before we get into the technology and the tips and the techniques, which I know you're longing to share, I want to begin with the personal. I want to know how you found yourself in this field, if it's relevant, and if you have your own journey to wellness, and if you'd be willing to share what that trajectory looked like. So why don't I begin with you, Andrea? And now you're muted.
Hi, thank you so much for having me. It's an honor to be here. Before I get into answering your questions and talking with everybody here today, I want to give a shout out to Momentum and say how admiring I am of your work and what a fan I am of everything you all do. And I hope this is just one vehicle. I know it's just one tool in your toolbox of how you can make women stronger and bolder and more empowered. So thank you for that.
Thank you.
I am Andrea Wolfe. I'm the CEO of the BREM Foundation. And wow, I got here in a bit of a circuitous way. I do, like so many of us Jewish women, have a personal connection to breast cancer. I started my life as my professional life as a lawyer. I worked at a firm here in DC, and then I was the director of public policy at Girls Inc. And one thing led to another, as life often does, and I ended up leading this organization. I think the breast cancer piece of this journey started well before I was born. My grandmother was 33 when she was diagnosed with breast cancer in 1970. And she was told she had 6 months to live. My mom was 12 at the time. She lived for another 43 more years. So she met her great grandchildren. And my mother, who is the director of breast imaging at GW, also had breast cancer at age 37. So it'll be no surprise that we are a BRCA1 family. And I was very committed to trying, at least, to not be the third generation of women in their 30s to get this disease. And so I had prophylactic mastectomies when I was 30, and stayed in my job doing public policy work, which I did love. But eventually I joined the board and they said, you know, maybe you're the right voice. And I said, maybe I am. Maybe we can use this for something really great. And so I came over 5 years ago, and the BREM Foundation has really innovated in the way that we find earlier, more curable breast cancers by doing education, access, and physician training, which I'll explain later on as we go. But it's been an honor to be on this journey with so many other women who have come to be a part of it with me. And also, I guess also relevant is that I have 4 daughters. So there is a selfishness to it in a sense, because I hope that their futures are even brighter when it comes to breast cancer than ours have been. Although I do think that technologies and advancements have made it such that this really can be a curable issue.
Clearly, and very different from your great grandmother and your grandmother's ages, but and yet, and still is terrifying. And Melissa, tell me about yourself.
Yeah, thank you. I want to first echo what Andrea says. The work you guys do is so inspirational. I find myself logging on to these boosts even when I don't have time to. So thank you.
We're hoping to hear that.
So I also had a slightly less circuitous route, but a nonlinear route to this. I have worked at Jewish nonprofits my entire adult life, doing informal education, doing community outreach. A little over 6 years ago, I received my second cancer diagnosis, and this one was a breast cancer diagnosis. And while I was going through my experience, I relied on Sharsheret support. And then when my treatment was complete, Sharsheret happened to advertise a new position, and it sort of felt beshert to me, meant to be, that I would take all of my informal education skills and my community outreach skills and educate Jewish women and healthcare providers and the broader community about risk and how to mitigate it and the importance of emotional or psychosocial support during this. And so now I spend my days either traveling across the country by plane or by Zoom, depending on the year that it is. And I educate communities about how they can be proactive, and that this is something they can take control of, whether it's through creating a customized screening plan like the video talked about, by knowing your family's cancer history and your own cancer history, or whether it's talking to your healthcare provider about what should be included in your screening plan. Also about healthy behaviors like eating healthfully, not all the time, but most of the time, or moving more. Not a marathon unless you want to do a marathon, but every day a walk or something. Mm-hmm. And of course, the hardest is reducing stress wherever we can. But those things, whether you carry a mutation or not, really do impact risk. And so these are things within our control. And I think the most important thing is that once you've done all of that hard work, the easy part is making the appointments that you need to make, whether it's to see your doctor or get your mammogram or get an MRI or whatever it is, to make those appointments and to not break them. Because
I want to ask you something just for a minute here. Yeah. You said something and it triggered me. You said that it's so easy to make those appointments. And for a lot of women, including some people I know, it's not easy to make those appointments. Psychologically, it's not easy. And it is psychologically easier to cancel them. How do we deal with that cognitive dissonance that women want to know and yet don't want to know, and so many appointments are canceled?
Right. Well, that's exactly where I was heading. You and I are thinking the same way. So physically making that call is the easiest part after you've learned your family history and done all of that stuff. But sometimes it can be difficult. And there are so many excuses we use. We have commitments at work. We have family obligations. We have volunteer things that we promised we would do. And they're not comfortable tests, and the information may be emotionally uncomfortable. But here's the thing. I think that if we reframe the importance of it, yes, it is about our personal health. It is, but sometimes that isn't enough for all of us. And we reframe doing this as a mentoring activity. Right? How will our children, our grandchildren, the women that sit next to us in synagogue, whatever it is, how will they know it's okay to care for themselves unless we teach them that by showing them that, right? It's so important, especially as women. We are always so used to caring for other people that we sometimes let our own self-care go by the side. And yet we would never want that for our children, our grandchildren. And this is the way to teach them, not by telling them, not by, do what I say, not as I do, but do what I say and do what I do. And so this is a gift for the next generation and the generation after that, and the people in your community, and as leaders in our community, this is what we owe the community, and it's so important to think of it that way.
You know what, that is a complete paradigm shift for me. I mean, there's so much talk about empowerment and personal empowerment. So many people are stymied by that concept, but it's an easier entry point if you think that you're making a difference for others as well, just by your example. Now, Andrea, you know, when we spoke originally, you talked about personalized screening and about risk stratification and new technologies that are critical to minimizing your chances of actually getting breast cancer and COVID for that matter. And you said that we would be surprised by what we learn, and it's not likely what we've heard before during typical Breast Cancer Awareness Month. Do you think you could elaborate on that for us?
Sure, it would be my pleasure. So look, breast cancer is a really well-marketed disease, right? You'd be hard-pressed to find anybody in this country of any age, really, who doesn't know what the pink ribbon stands for. We see it all the time. And there is, frankly, a bit of a pink ribbon weariness. Like, okay, here we go. It's October. We're doing this again. We see sides of buses. We see billboards. We see pop-ups about mammograms. We see it literally like on lettuce containers. It's everywhere. And yet with all that publicity, the messages aren't nuanced. The messages, I would posit, aren't even that accurate. And I'll tell you why. Okay. Because what they say is, get a mammogram, get a mammogram. Okay, we need a pithy soundbite to get people to see something, but really that's not enough. We don't know when. We don't realize that a mammogram is often insufficient, and I'll tell you why. We don't realize that there are risk factors and screening options that are so varied, person by person and population by population, that saying get a mammogram almost does it a disservice, and people are tired of it, and it's not a good message. I mean, it's a good message because it's better than nothing, but it's an insufficient message.
What would the right message be?
What?
What would the right message be?
Right. So we live in a super personalized society, right? We personalize our phone cases. We personalize our Facebook pages, our salads, our lipstick, like the video said. Like everything is personalized. And yet when it comes to breast care, we seem all okay with standardized. And that to me should be paramount, right? These life-saving screenings that are once a year and aren't particularly egregious, even though sometimes people feel very anxious around them. They need to be personalized too. And what that means is that you have to know your personal risk factors. You need to know your family history, your genetic history, if it's applicable, especially in a group of Jewish women. You need to understand what might make you at slightly higher risk or even more than slightly higher risk. And I would say the most common one that is not often talked about is breast density. So breast density affects 40 to 50% of the population of women. Women, premenopausal women, about 67% of them have dense breast tissue. Postmenopausal women is about 25%. It does change over time. And this breast density just means how much connective tissue you have as opposed to fatty tissue in your breast. You can't know it by feeling, touching. It's saggy, small, big, it doesn't matter, perky. What matters is what they see on an image. And the reason dense tissue is a problem is because you are 4 to 6 times more likely to get breast cancer when you have dense tissue, so more connective tissue, less fatty tissue. But it is much harder to see those cancers on a mammogram. Why? Because dense tissue looks white and cancers look white on an X-ray. So there's no contrast to see the cancer. Well, what do? It can be as simple as an ultrasound. An ultrasound, as many of us know, is a non-invasive, no radiation, probably 15-minute exam. It does not hurt. It's very simple. And so if you add an ultrasound with your mammogram, you're about 25% more likely to find that earlier cancer in dense tissue. So this affects a lot of people.
Okay, hold on a second. Can anyone just ask for the ultrasound? Melissa, for example, to your knowledge, do you have to say to the technician, I have dense tissue, I need an ultrasound and will they just give it to you?
So you ask great questions. So like I said, the only way to know if you have dense tissue is to get your first mammogram, which you need to get when you're 40 at the very latest, and every year. There's a lot of...
would they have told me if I had dense tissue? I mean, nobody.
That's a great question too. So that gets, I'm going to put on my public policy hat. 38 states and the District of Columbia have laws that mandate that in your mammography report, you hear something about density. Whether they tell you if you have or not varies state by state. Mm-hmm. Right now, the FDA is considering a new rule to standardize it across the country so that every mammogram report has to tell you in particular language that you have dense breast tissue, that it's a higher risk factor for breast cancer, and that there are screening options available. That has not happened yet, but it definitely will. So most likely, yes, you will know if you live in one of the 38 states in DC. The Brown Foundation actually drafted and then got passed unanimously the DC legislation. So this is something that I obviously care about very much. Once you know whether you have dense tissue, though, the question is, how are you going to get those exams? Well, you can ask for them. I am now on a mission, though, to increase insurance coverage of those exams because they're not always covered. And when they are, sometimes there are higher copays, out-of-pocket costs, those types of things. Mm-hmm. If you are fortunate to be able to pay out of pocket and it costs about $250, then yes, you can ask for it. If the center that you go to has it, they should give it to you, and that's that. If not, I'm a big advocate of self-advocacy, and if you want something and you're not being offered it, go somewhere until you find what you think you need and talk to people until you feel satisfied.
Wow.
So you know, those, and the last thing I would say, and I'm happy to actually send Momentum an article I recently wrote about this, is that we need to change the way we talk about these screenings. So until this point, they were talked about as supplemental or extra screenings. And I would say we need to start a campaign to call them essential life-saving screenings, because that's what they are. And a mammogram and dense tissue is not enough.
Okay, that's incredibly helpful, truly. Melissa, tell me other kind of misconceptions and things that we need to know in order to truly advocate for ourselves.
Absolutely. So I have a couple in mind. One is that this only affects women. And that is patently false. First of all, men do get breast cancer, obviously at a much lower rate, but they do. But if somebody carries a BRCA mutation, again, it's a small population overall that carries it, but in the Ashkenazi Jewish community, much higher than the average. So if somebody carries that mutation, that person can be a man or a woman, and they can pass it down to a child, male or female. And unlike something like Tay-Sachs, which we're all familiar with, only one parent needs to be a carrier for it to be passed down. Whereas Tay-Sachs, as a recessive mutation, both need to be carriers for it to be passed down.
Hold on one second. You know, when a Jewish couple gets married, there's often a pre-screening for that. Is there a pre-screening for Braca?
So there is, but it's not a part of that prenatal or premarital screening. It's a different type of screening. So very often we'll hear people say, oh, but I got screened before on campus through an organization, or when I was pregnant, so they would have told me. No, it's a completely different type of screening. And there is a screening. And if you haven't spoken to your doctor about it, you should have that conversation as to whether or not that screening is warranted. And there are lots of different thinking. There's lots of different thinking. There are people who advocate for population-wide screening, especially within the Jewish community where we're at higher risk. But whether you're in that, you hold that belief or not, if you have a relative who was diagnosed somewhat early, if you have several relatives who were diagnosed at any age, and by the way, it's not just breast cancer. Today we're here to talk about breast cancer, but those BRCA mutations impact breast cancer, ovarian cancer, pancreatic cancer,
prostate cancer,
melanoma, and male breast cancer. So what that means is you don't have to have a history of breast cancer in your family to be at higher risk. You could have a history of prostate cancer or pancreatic cancer or an assortment, and still it would be worth it to get that screening and treat yourself like you're at higher risk.
Wow.
Can I add two practical points to that, Melissa? I totally agree with you and am grateful for what you're saying. A couple things. One is the Brown Foundation has a relationship with a genetics testing company called Color. Just to allay any fears, this is often done by spitting in a tube. It's a super easy test. You can literally get it in the mail just because you want it. You don't need a doctor's orders. It used to cost $3,000-$4,000. Now it costs $200-$250 to just get it so that you know. And that $250 doesn't just do Braca. It's a panel of 36 cancer genes, most of which are much less publicized and well known than Braca, which is also BRCA1 and BRCA2, two different mutations. So this is very easy if you want to know. The biggest hurdle we see, frankly, is that people don't want to know, even when they have strong histories of cancer, because they're scared of what that means. I would also say that if you have a very male-heavy family, right, a family where there's a lot of sons and then a lot of sons and a lot of sons, right. Definitely not my family. No. Then you have to dig deeper. And as Ashkenazi Jews, we also have to dig deeper because the Holocaust wiped out a lot of our family histories. We don't have a lot of records and we don't have a lot of people to necessarily talk to who go that far back. Right. And it used to be a stigma and a whole host of other things. But make sure that, practically, these things so that you can dig deep enough and that you can, ask about aunts and cousins and others.
So that's wonderful advice. Hey, Melissa, before you begin, I just to ask for both of you.
Yeah.
About the self-exam. I mean, the truth is, like, every time I take a shower, I'm checking around and I'm having a heart attack while I'm doing it. I can't calm down. And it's like, I think everything is a lump. I can't be the only one out there who, feels that way. What are we looking for precisely? And is there ever times that you can get breast cancer without feeling a lump first?
Yeah, that's what I was going to start with. So obviously a lump is the most well-known sign that something might be amiss, although a lump doesn't always mean breast cancer. Let's be very clear about that. But there are a lot of other signs, including change in texture on the skin on the breast, or dimpling, or discharge. And it might not just be the breast. It could be underarm. It could be, at the top of our torso or underneath our breast. So it's not just breast lumps. That's a big myth. In terms of self-check, I'd be very interested to hear what Andrea thinks, but it is very important to know what is normal for your body, regardless of the official prescription to do self-checks or not. Every one of us needs to know what's normal for our body.
Yeah, no question. I agree. And self-exam has always been something that we've supported and is a savior, especially during the beginning of COVID, when screenings shut down. Self-check, there is no harm. About 20% of breast cancers are found through self-check, so it's a lot. And I just can't understand for the life of me why anybody would not want to do it. Now, you should do it the right way. And the Brem Foundation actually has a really cute animated video that we just put out about breast self-exam. And I would be happy to send around the link afterwards if you'd like.
That would be great. Now, can you also tell me the name of that genetic testing?
Color. And if anybody wants to talk to me, we have a relationship with them, so we get a discounted rate. If anybody on the call is interested, you can just email me at andrea@bremfoundation.org. Really easy.
So a good thing to know about that screening is, like you said, it's very easy, and you can go through color, or your doctor could write a prescription and you can go to the lab next door to your office or whatever it is. Absolutely. But one thing I would say, and I think it kind of harkens back to, Adrienne, something you were talking about earlier, is Sharsheret feels very strongly that if you're going to get screening, this kind of genetic screening, you should do it with the benefit of a genetic counselor.
Absolutely.
100% right. And ideally it's before and after, one to help you prepare, both knowing, what test you're getting and why you're getting it, and after to help you understand the results, both from a medical perspective and an emotional or psychosocial perspective. So you had mentioned, what do you do if it's just too hard to pick up the phone and make these appointments or make the call to the genetic counselor? And I think one misconception is that breast cancer is a physical disease. But it's really not just physical. There are a lot of emotional and psychosocial components. And in fact, studies show that patients who have their non-medical needs met do better medically. So, and that's where Sharsheret comes in, right? We have a genetic counselor who's able to talk to you. We have an amazing team of social workers who can help you at any stage, pre-diagnosis, during the diagnostic process, during treatment or survivorship. And in addition to psychosocial, there's also a spiritual component. And when you're dealing with a life-altering disease like cancer, it's important to recognize that they're all equally important and part of a treatment team. And that's where organizations like Sharsheret and BREM can be of help too, either with programs we have or with referring to other organizations we partner with who offer a particular, service that someone's in need of. And it's so important to think of it as a three-pronged approach to healing.
Ladies, I don't think we've even scratched the surface, or I didn't realize how emotional this would make me feel, because I do have anxiety around it, and I did not realize that other cancers made the possibility for Braca worth looking at. I had no idea. So just for this, I personally thank you. We do need to have this conversation further and have it again. It was a good way to begin this month. But again, as I said, you are such a font of wisdom, both of you, and I don't feel like we got through a half of it. So please come back to me again to continue it. And before we do, I want to show you, I want to show everybody out there, one of the women who responded to that Facebook question I had. So just take a look at this.
Hi, my name is Rachel Slavkin. I'm from Orlando, Florida, and I went on the 2016 Momentum trip to Israel. I went on the trip following a bilateral mastectomy that I had had a few months prior, and the trip was a great way to end what had been a pretty awful year. But one of the best pieces of advice I could give to the friends or family that are helping to care for somebody going through breast cancer is two things, actually. One is I know this sounds pretty simple and silly, but I needed a back scratcher because I couldn't lift my arms up to scratch my back or other parts of my body. So having a back scratcher in the hospital with me was key. It also was great for trying to reach things on the hospital tray, like my water, when it was just a little too far out of grasp and I couldn't extend my arm to reach. The other thing for caregivers that I found helpful, everybody will send meals and everybody will talk about having meals sent and taking care of kids, but something that other people might not always think about is sending somebody to clean the house, because when somebody is having a bilateral mastectomy, coming home from the hospital or coming home from chemo treatment, they really need, especially in the times we're living in now, they need a sterile environment. So sending somebody in to do a deep cleaning of the house is very, very helpful. If you are going through breast cancer, I wish you all the best, and know that you and your body are beautiful and you will get through this. Bye.
You're muted again, Adrian. You're muted. You're muted.
There we go. Did that open?
Yeah.
Yeah, it's an interesting thing today. We're having technical challenges, and yet we got such incredible information from you both, Andrea and Melissa, and we're beyond grateful for the beginning of this conversation. It's been really illuminating. And there have been a lot of questions and comments, and we're sorry that we were unable to get to all of them.
Adrian, before we end, can I just say one other thing that I really would like to say before we end? Don't let COVID be a reason that you skip your screenings. The National Cancer Institute is doing modeling that over 10,000 people are going to die because they skipped their screenings this year. We can't let that happen. The centers are doing everything right in terms of COVID safety protocols. So go, make sure you feel comfortable, but don't skip.
Oh my goodness, that was Write to me. Thank you, I think. Yes, thank you. So really, may all of
And
us be.
if you need something to keep you committed to doing it, the Brown Foundation is passing around a pledge in October so that it can be public and you can put your name to paper, but don't skip in 2020.
Okay, which was what I was actually doing, 4 months overdue. So I bless all of us. I bless all of us with the strength and the wisdom to listen to these women and to do what needs to be done. And may we all be blessed with renewed health and complete recoveries wherever we are.